and welcome to Let's Talk Endometriosis, Decoding Period Pain. I'm Dr. Shalu Khatri, and today we are shedding light on a condition that affects millions of women worldwide endometriosis. Despite its prevalence, it often goes undiagnosed or misunderstood. So, today, to help us navigate this topic, we have with us Dr. Anita Soni, consultant obstetrician and gynecologist, LH Hiranandani Hospital, Mumbai, joining today. Welcome, ma'am.
Thank you, Shalu. I'm so happy about the fact that you guys have taken it upon yourself to talk about endometriosis because it's not funny. The incidence is going up. The pain that the patients suffer from is excruciating, and somebody needs to talk about it and kind of reassure them and give them information. Otherwise, by the time they come to us and we see them, it's already affected a lot of their quality of life.
Exactly, ma'am. That's what we have also observed with our patients. So, starting with the first question, what we have with us, we hear a lot about painful periods, but exactly how can someone tell if their pain is just a bad period or something more serious like endometriosis?
You know what? I would like to start with saying endometriosis is not cancer, but it is akin to cancer because it eats into the tissues. So you have to understand that the patient who has endometriosis will complain of severe excruciating pain. Very rarely will the patient be asymptomatic. Now, what is pain? Pain is only a very subjective thing. Somebody feels pain with just a little injection, someone dances all around the building to take one injection. Because it is subjective and period pain has been going on since thy kingdom come. So people, or in fact the mothers in the family, are ye to humko bhi hua kind of thing. And they negate pain for the patient, which is not fair. If the person or the child or the lady is unable to cope with daily activities, the pain is specific to the period, post period, and may be exacerbated even during ovulation. Think endometriosis. Train your mind because endometriosis is not severe endometriosis at the start. It starts very slowly and it bites into the tissues. So, if you pick it up early, a lot of medical modalities are available before it affects fertility and life in general.
Thank you, ma'am. That's really something I was not very aware of. Thank you. Moving forward with next question. We hear so much about endometriosis. Could you break it down for us? What exactly is endometriosis? I understand that you did mention a little in your previous response, but going a little more in the detail, and why should we be aware of it?
Okay. Endometriosis, by definition, is the presence of normal lining of the uterus in places other than the normal uterine cavity. Now, to break that down, endometrium is normal lining of the uterus. It is there. It is the bed which is formed for the baby to come and lie. And if there is no pregnancy, you shed that bed and you get a period. Now, that lining is not supposed to be anywhere else other than in the endometrial cavity. When that lining is present outside of the uterus, like in the ovary, you can get chocolate cyst. Now, that's not chocolate material that's coming out of the ovary. That is broken down blood, which forms a cyst or a blood filled cavity. The other thing is when it is outside near the intestine, it can cause adhesions. It can form a layer over the bowel and the bowel comes and gets stuck to the uterus. So all these are extra uterine causes. Now, the last thing but not the least is when it is within the wall of the uterus, then it is called adenomyosis or endometriosis interna.
Okay. Okay. Thank you for the response, ma'am. Moving forward with the next question. Is it true that endometriosis can sometimes go undiagnosed for years? And why does this happen?
Oh, yes. See, endometriosis today, you have to understand the physiology of endometriosis. It is endometrium, and now that is hormone responsive. So, which is the hormone that responds? It is called as estrogen hormone. And estrogen hormone is found in every woman, especially from adolescence right up to menopause. Constantly when the endometrium is being responsive to this hormone uninterrupted, meaning when you get pregnant your progesterone increases. If patients are planning pregnancies much later, they're getting married at much older ages, some of them are choosing not to get pregnant. So this constant estrogenization without that break of the progesterone during pregnancy. So this becomes extremely, extremely important for us to understand. And some patients consider, pain to period ke time pe to hota hi hai. So they don't really even consider that it could be an abnormal amount of pain. And trust me, I saw one patient just a couple of days ago who had severe bowel endometriosis with a huge cyst. Incidentally, she went for gallbladder surgery for cholecystitis. And the surgeon called saying, ma'am, please come and have a look. She has a huge cyst in the ovary. So there are patients that go undiagnosed. Maybe they consider pain as normal, or some of them are just very high thresholds of pain, or some actually don't feel the pain. But endometriosis can present even in asymptomatic individuals. Hence, we tell patients routine ultrasounds, keep a watch on what is going on in your body for you to get a better idea.
Thank you, ma'am. That was very important information, even for me, because we also don't go for regular examination that often.
Exactly. See, most people tend to look at doctors with tinted glasses. And when you advise an investigation, अरे यार ये लोग तो कुछ diagnose नहीं करते, ultrasound बोलते, test बोलते, but it is not for personal benefit. It is a screening tool. It is one of our biggest, investigations which is available to us in our armamentarium as a gynecologist. And some of us have our own machines. So you can actually go as close to the uterus as possible and study what is going on in the pelvis, because otherwise, how do you pick up problems?
Rightfully said, ma'am. Rightfully said. I think this is something that is also needs to be picked up by the patients as well, a regular examination. Thank you. Thank you for the response, ma'am. Moving to our next question. Could you walk us through how endometriosis is diagnosed, since we talked about it, that regular examination is done? And is it just through symptoms, or do we have any specific tests for it?
Again, endometriosis is actually classified for the layman into mild, moderate, and severe. So early endometriosis is on history. You start suspecting it. Diagnosis is on investigations and tests that you do. But otherwise, you start suspecting on what the patient is talking, what the patient is coming to you with. Some can come with even simple thing, I can't have sex, penetrative sex is extremely painful. So that's dyspareunia. Again, you're thinking, does she have something posterior to the uterus which is causing her pain? So the presentation can be varied, but the diagnosis is your antennae go up when the patient talks pain. Then, other than the history, you would like to do a detailed clinical examination. If the patient has been sexually active, you will do a pervaginal examination, the size of the uterus, the mobility of the uterus, whether the uterus can move left and right, and whether the patient is feeling pain at the time of clinical examination. Then you do an ultrasound, like I had mentioned to you earlier, that will prove your diagnosis. Now, when you have cysts in the ovaries, you also would like to screen for other things, like, you don't want to miss out on a cancer, or you don't want to miss out on any other different type of cyst. So you may look for a slightly advanced MRI, if at all required, to look at the extent of the endometriosis. And in case surgery is required, you can plan it accordingly rather than being caught unawares on table.
Thank you, ma'am. That's really a new piece of information for us. And besides that, we have also been hearing about this a lot, actually, that whatever problems are we facing today, they are because of because of poor lifestyle and dietary modifications that we have made or inculcated in our lives. So is it true for endometriosis also? We want to understand what role do diet and lifestyle play in managing endometriosis, and can it really make a difference if one modifies the lifestyle?
That's a really very good question. And shallow, it is very important in today's day and age because people have to understand the price we're paying for modernization. Food was never bad. Any kind of food was never bad for anybody. But as we have gone modern, our lifestyles have changed. What we used to do, physical activity, that has decreased markedly, and we're doing very sedentary lifestyles. We're using computers, we're using phones, we're using all kinds of technology to kind of, move along in our careers, but we're not facing our problems physically because our physical activity has decreased. Our food is now becoming difficult to digest or utilize. So what we do is you kind of cut calories. So anti-inflammatory diets, low carb, high protein diets, inculcating a lot of fruit and veggies into your diet, eating adequate amounts of proteins definitely helps decrease the incidence of hormone dependent problems like endometriosis. Today, PCOS has become like every second girl you see in urban society suffers from PCOS, which wasn't the case all these years. So, because of modernization, because of family history of diabetes, we're seeing a shift in the medical presentation, which all of us have to understand. Going back to your question, as far as diet is concerned, there are lots of fads available in the market. Some people talk about including good bug, or sorry, I'm naming things, but including lactobacilli, including gluten free. There are dime a dozen available, but the bottom line is either you burn what you eat, and if you're not able to do that, you go on a calorie deficit diet, you go on anti-inflammatory diet, you do a low carb, high protein, and you'll be good to go.
That's good to know, ma'am. Even I have started working out regularly just to uh, avoid
Can,
diseases.
can I interrupt? Working out helps toning you. It does not help preventing diseases. What helps is adjusting or coming down to 90% is diet, 10% is physical activity. So, what you eat, vis-a-vis what you do. Because the rest of the day, if you're going to sit in front of the idiot box trying to, cope with daily work, then the diet becomes extremely important other than only the workout.
Thank you, ma'am. Thank you for correcting me. That was indeed very helpful. Besides that, ma'am, just wanted to understand, are there any myths about endometriosis that you hear a lot? I mean, I think we should clear some of those up. So if you have any that you hear.
Endometriosis is ridden with myths because endometriosis starts at adolescence, goes up to the perimenopausal or postmenopausal age group. So anyone that has pain, the first thing that everybody feels, ye to natak kar rahe hai. It is not really true. Endometriosis is a hormone dependent problem. The incidence has certainly increased in the last decade or so. Again, that is because of modernization, because of our genetics, because of our delayed pregnancies. But the fact still remains is we're seeing it. And we've got to deal with our problems as we're seeing it. So it is a genuine entity. It is not a fantasy. It is not a myth. We've got to live with it, and we've got to learn how to prevent it or early diagnosis so that you can prevent progression of your problem and arrest it where it is till you can get into a reproductive phase where people believe, there are a lot of people say that एक बार pregnant हो जाओ ये तुम्हारा सारा दर्द चला जाएगा. It doesn't happen so because your hormones, yeah, for that 1 year it is controlled, it is subdued. But the minute you have delivered, after that, what? It's back, boom, back again. And when it comes back, it really comes back with a bang. That is where you have to understand what is sustainable is what you should practice. And you have to be one step further or smarter than the disease rather than chasing it, because that's where the problems happen.
Rightfully said, ma'am. Uh, Besides that, can endometriosis lead to other health issues also if it is left untreated?
Oh, yes, endometriosis from bowel to bladder to fertility to uterine cancers and ovarian cancer. All of these have seen to have a marked increase in patients who suffer from endometriosis. So, from small problems to major life threatening issues, endometriosis is known to be a progressive disease and can affect not only your eating habits, your bowel habits, your urine, normal things that you would take for granted in everyday life can be affected because of the involvement of the mucosa or of the organs with the disease. And this progresses over time. And in later ages, because of the hyperestrogenic state, can or may result in cancers too.
Okay, that is something very informative, ma'am, for patients also who who consider endometriosis as just period pain. They should
So
definitely be made aware of it.
that is why I congratulated you, because I am so excited to be a part of this. For the first time in so many years, people are addressing the problem, are willing to go out and talk about it. Otherwise, you're a lone fighter yelling from rooftops, and people find you the odd man out because not everybody wants to address it.
Exactly, ma'am. Exactly. That's why we all need to join hands and move forward in this direction. Moving to our next question, ma'am. Do you have any advice for women who suspect that they might have endometriosis, but they haven't seen a doctor yet?
My first advice to all mothers, mothers in law, and women in general: please do not look at your doctor with tinted glasses. If you are finding that you are going through some amount of pain, which is worsening month on month, which you feel is you're unable to cope with, which you feel is affecting your day to day routine, if you're unable to cope with your daily activities, please consider going to the doctor. Don't get scared, because if you pick it up early, not all endometriosis needs to go undergo surgery or needs to go under the knife. Medicines are available which we can give you, which are relatively safe, and it prevents the progression of the disease. Arrest it where it is so you don't have any problems later.
Thank you for that, ma'am. Like you said in the beginning, that mothers and mother-in-laws. So, briefly touching upon that, we wanted to understand that how can friends and family support someone who's dealing with endometriosis?
Like I said right at the very start, endometriosis is not cancer, but it is akin to cancer. It's an extremely painful disease. It tends to eat into your tissues. So, the first thing that you would do is tell the patients you have a cure. We understand you. Be supportive. Provide them with relief from those painful days, from things that they are unable to cope with. As a family, sit with her, try and cook, give her things that she would like. Two, take her to the doctor, get her investigated, and get her treated as soon as possible. My bottom line is nobody's going to get a gold medal to suffer from pain. If there is pain, look for a solution to your pain. You are not going to be credited, greatly for suffering. So please support the woman. Don't look at her like, being a cantor or not wanting to do a particular activity. Empathize, sympathize, and please address the problem. Don't run away from it.
That's correct, ma'am. And s- since we are talking about the management and pharmaceutical management also, and where it can delay the progression of the disease, I wanted to understand, does endometriosis ever go away on its own, or it's something that requires ongoing treatment?
Endometriosis repeatedly has been called an enigma. In gynecology, very few diseases are called that. It never ever goes. You can only control it. Treatment is sustainable. Not everybody requires surgery. Medical management, lifestyle change, diet, exercise, all the rest. And if it is as severe, surgery is to give you relief of symptoms. But if you don't proceed with treatment for long term, it will come back, because the hormones are not changing. You are only treating or undergoing surgery or taking medication to control the problem at the moment. You're firefighting the problem. But if you're looking for 100% cure, Unfortunately,
You did mention about a couple of myths that are lying around for endometriosis, and one of them was that it cure if after pregnancy it settles down or it gets cured. So, can we discuss more about it in detail? Because I think it's the most common myth that is floating around for endometriosis.
see, again, we go back to the pathology. What happened? Why did endometriosis come? Because of that hyperestrogenic state. When she is pregnant, progesterone is high. So the endometriosis is under control. Post delivery, your prolactin has increased, she's lactating, she's still not menstruating, endometriosis is under control. When her biological clock comes back to normal, that is the hypothalamo pituitary ovarian axis, now starts working in tandem with each other, the ovulation starts again. So the estrogen starts appearing back again. The minute that happens, whatever endometrial tissue is present outside of the endometrial cavity wakes up again, and boom, you've got endometriosis back again. So that is the physiology. So you have to understand that there is no cure for the endometriosis. You have to be able to arrest it or maintain that period under hormonal therapy so that it doesn't come back. It stays latent for that much period of time till you don't want to plan another pregnancy or you're not looking at other things. So lots of medical modalities are available, be it oral medications, be it intrauterine system, be it injectables. Basically, you're suppressing the hypothalamo pituitary ovarian axis, decreasing her hormones, hence keeping the endometriosis under control.
Thank you, ma'am. Thank you so much. That was pretty informative for all of us. We have now actually reached the end of the session. We would like you to give some closing statements about it.
Talu, like I said, congratulations to Bayer for addressing a problem which has been ongoing, which has been there from time immemorial, and very few pharma companies have taken it up. Endometriosis is an enigma and will always remain so. But today, with advancing science, we're learning that pain can be controlled. And if you detect early endometriosis, you can prevent progression and you can prevent it from becoming debilitating. So please get screened, address the problem, visit a regular gynecologist. All of us are here to support you. You are not going to get a gold medal to suffer. Please address the problem. Don't run away from it.
Thank you, ma'am. Thank you once again. And this statement that you will not going to get a gold medal for tolerating the pain or for suffering is something that's going to stay with me because that's what our elders also tell us that, oh, are you so weak? Are you uh, so fragile that you can't tolerate a little pain here and there? So this is something that's going to stay with me. And if next time somebody asks me to uh, be more uh, uh,
Tolerant of pain, you
tolerant
don't
of
need to.
pain, this is what
You
I'm going to tell them. Exactly. So, once again, thank you, Dr. Anita. It was a pretty informative session for all of us. There are so many new things that I also came to know. And for everyone, I would say that if you suspect you have endometriosis, please don't wait. Speak to a doctor. And like Dr. Anita mentioned, that don't look at your doctor with tinted glasses and may you get regularly checkups done. And for more of such updates, I would say that you like, subscribe, and follow Buyer for Her and Buyer for Health for various latest updates. Until next time, stay informed and take care. Thank you.
Thank you.